Hello, my name is Dr. Dewan S. Raja. Today I will discuss about respiratory alkalosis. The respiratory alkalosis is defined as a partial pressure of carbon dioxide below 35 mm of mercury with an increase in serum pH above 7.45. pH is the negative logarithm of hydrogen ion concentration. Acute respiratory alkalosis is most commonly caused by hyperventilation. That means breathing too much or giving too much air inside the lung. Partial pressure of carbon dioxide may reduce to 25 to 35 mm of mercury, with further decrease resulting from concurrent metabolic acidosis or hypoxia. The arterial blood gas profile, that is the ABG, is as follows: pH high, bicarbonate level low, partial pressure of carbon dioxide is low. Okay, so what are the causes of respiratory alkalosis? There are many causes. Stimulation of the respiratory center at the middle oblongate of the brain stem may be caused by anxiety. It may be a test anxiety or job interview anxiety, fear due to any reason, hysterical hyperventilation, early shock, early sepsis, trauma, salicylic poisoning. In case of salicylic poisoning, it is an acid. It also causes metabolic acidosis, CNS infection, cerebrovascular accident, neurologic disorder, tumor, and stroke. So, causes of respiratory alkalosis include stimulation of the medullary respiratory center, hypoxemia. Hypoxemia due to congestive heart failure, asthma, there is bronchial asthma, pneumonia, pulmonary embolism, mechanical ventilation, or high altitude like mountain climbing, or it may be due to faulty mechanical ventilation. Other causes include pregnancy, liver disease, and hyperthyroidism. What are the sequences of event? Number one, loss of carbon dioxide because of mostly hyperventilation, decreased partial pressure of carbon dioxide. There will be increase in pH, okay, and decreased concentration of bicarbonate. Buffering occurs in intracellular fluid, particularly in red blood cell. Carbon dioxide leaves the cell and the intracellular pH increases. Renal compensation, decreased excretion of hydrogen and titrable ammonium, decreased synthesis and reabsorption of bicarbonates. And we have no respiratory compensation. Acute respiratory alkalosis, there are two types of alkalosis, acute and chronic. In acute, pH is high and there is no renal compensation. In chronic renal alkalosis, there is renal compensation and the pH is going to be normal or close to the normal. Clinical finding depends on the severity and acuity of the process. Acute symptoms include attributed to hypocalcemia. Why hypocalcemia? Because there will be less attachment of the hydrogen to the albumin, so the calcium will attach to the albumin, so there will be no or less free calcium, so that leads to Hypocalcemia, calcemia lacking, the free calcium is lacking, is manifested as circumoral and digital paresthesia and carpopedal spasm. Lightheadedness, another adverse effect, the symptom, another symptom, lightheadedness due to cerebral vasoconstriction. We may also get dizziness, confusion, and altered consciousness. Chronic respiratory alkalosis may result in hypophosphatemia and lowered seizure threshold. Treatment depends on the cause, treating the underlying cause. Advising the patient may be advised to breathe from a closed sac. Okay, and that's all about the respiratory alkalosis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.